of Moments in Medicine Live. It's a live broadcast that we bring you every week here on the Nebraska Medicine Facebook page. And today I think we have a topic that a lot of you are going to be interested, especially with summer being here, wanting to look good in those bathing suits, shorts, short-sleeved shirts. We're talking about weight loss, but if you need a little something extra, if you need some motivation, if you need some supervision, we're talking about medical weight loss without surgery. So thank you to our guests for being here today. I have Rebecca Cray and Jackie Schwartz, who are both nutrition therapists. Thanks for joining us.
You're welcome.
Thanks.
All right, a little bit of a disclaimer before we start. This is an informational chat. It's just for informational purposes only, so if you have any questions specific to your health or medical condition, we want you always to direct those directly to your doctor. So we're talking about medical weight loss today, and that doesn't necessarily mean surgery, but there are options out there for somebody who needs that little extra help. So we have a program here through the Bariatrics Center at Nebraska Medicine called New Directions. What is the program all about?
Yeah, so the New Directions program is our medically supervised meal replacement program. It uses meal replacements, which are shakes, soups, puddings, bars, there's entrees as well, and it allows you to use those meal replacements to help reduce your calories, focus more on the behaviors, and really just kind of tackle weight loss in a little bit more controlled way while doing it safely with the medical supervision.
So this program's a little bit more extreme than somebody who might be looking to lose just a couple pounds. Who makes a good candidate for the program?
You know, there's a few things that we look at that might limit your options for it. Age is something that we look at, your current health status, your current weight could make a difference as well. So we do always encourage you to come in and we can talk about that more one-on-one to see if you would be an appropriate candidate. There's 2 different versions of the program, which is helpful because most people can do the program.
It's the kind of program that people know sometimes you just need support. Sometimes you need somebody who's there. You need accountability, right?
Yes.
So there's a meeting component to this too.
Correct.
So how does that work?
Yeah, so when you are actively in the program, we do encourage people to come to class once a week. We have a variety of different times that you can choose. We know we're all busy and our health usually gets put on the back burner, so we do try to make it convenient, but there's so much power in the group. You learn from people in the group, not only the education that we provide, but you're in a room with people who are all working towards the same goal and a lot of times experience the same struggles that you're going through. So it's very supportive and the accountability is a really big piece as well.
Absolutely. Jackie, I'll keep talking to you about New Directions. We're not ignoring Rebecca, by the way. We are going to talk about some other high-tech tools that we have available through our bariatric center that could help you on your weight loss journey, because it's not one size fits all. So if somebody comes in and they contact you, how do you help them figure out what option is right for them? And either one of you can take that one.
Yeah, so we start with, as someone calls the Bariatric Center, we ask them to start with an information session. That is now done online, so one of our medical receptionists can help set you up with the link to watch that information session. So when you watch that video, it walks through all of the options we offer in our center. You mentioned earlier we do offer bariatric surgery, and then these non-surgical options that we're talking about today, such as New Direction, and then we also offer medical weight loss, which is a program where you can work individually with a dietitian one-on-one to provide a lot of those things that Jackie just mentioned, an individualized plan for you, that support, that accountability, that monitoring of your success. So then from that tool, from that information session, our clients can call and kind of set, if they have a preference where they go, to come in and meet with a member of our team, and then we can help them determine the best course of action from there. I will also mention New Direction has an in-person information session as well, so if you know you're interested in that program, you can come into our center for an in-person information session.
And I think, Jackie, let's segue into that. When somebody comes in for an information session like that, what can they expect?
Yeah, so it's usually done in a group. We can also set it one-on-one if that works better for you, just to talk about some specific things. But we will go over the 2 different versions of the program, which is a low-calorie and a very low-calorie plan, so that you get a feel for what might be the better fit for you. We talk about everything so you completely understand the aspects of the program to help decide if it's the right tool. These are all just different tools, and like you said, there's not a one-size-fits-all for every person. And so that's our goal, is to really dive into what would be the most beneficial tool for you.
So you mentioned the low calorie and the very low calorie plan. People probably want to know what kind of, obviously results are not always typical. Every case is different.
Yes.
But what can somebody kind of expect coming in as far as weekly or monthly?
Yes, so the very low calorie diet option is obviously lower calorie. It just uses those meal replacements. So it's a total meal replacement program, which is great. I call it your vacation from food. You don't have to think about what you're eating. The products are portion controlled, calorie controlled. You can really dive in more to the behavior aspect, which is what most of us tend to struggle with when it comes to
Can you cook for my
eating
kids
and weight.
then?
Yeah. Hire someone to come in for it. Exactly. So typically the weight loss we see there is anywhere between 2 and 5 pounds per week. But I like to stress that it can change week to week. It's not always a perfect amount of loss every time. With the low calorie option, it's a little bit higher calorie, still a low calorie diet, obviously. The weight loss does tend to slow down a little bit. I would say anywhere from 1 to 3 pounds a week is typically where we would see.
And what do you tell people that enter New Directions about their fitness level? Because probably if they're on a very low calorie program, they're not going to be wanting to do an intense workout. How do those things work together?
Yeah, that's a great question because they are different with both of the programs. In the very low calorie option, we still want you to get up and move throughout the day, but we just don't want you exerting yourself too much. So we do give you some guidelines there. You can still walk, do those activities as long as you're not getting your heart rate up too much. With the low calorie diet option, there's not those restrictions. We still want you to be active and just listen to your body, especially if it's an adjustment for you for your calorie level. It could be quite a bit lower than what you're used to doing.
What about maintenance? Because eventually people will, if they stick with the plan, if they listen to you guys, they will get to that point. And you don't just leave them on their own like, hey, good luck out there. So what does the maintenance portion of the plan look like?
Yeah, so maintenance is the most important part. I tell people that's where the real work comes in, and because that's where most of us struggle, is gaining that weight back. And whatever tool you go with, I think it's important to think about what maintenance looks like. With the New Directions program, we do have a specific maintenance program where we still encourage you to come into 2 classes a month. You can come in more frequently if that accountability is beneficial for you. So we're still checking in on you. That accountability is there. You can still use the meal replacement products if you would like. But everybody has an individual appointment where we really sit down and focus on what's your plan, what does real life look like for you, so we're not just sending you to go back to your old habits.
What do your clients tell you about how the food tastes? It's always an important question.
That is a great question. So I have worked with multiple medical meal replacement programs. I would say the New Directions, taste-wise, are my favorite so far. We've got a variety of flavor options and lots of different ways you can switch up the flavor. So I've not found anyone yet who has not been able to stand the flavor of any of the products. So I have a lot of tricks up my sleeve for them.
Right, and sometimes just actually having someone tell you this is what you eat.
Yeah.
Some of us need that guidance to really finally get that mindset to switch. Rebecca, we don't want to ignore you. And some people might have noticed that we have this fantastic little machine back here hanging out. So this is one of the tools that you can use, not necessarily just with the New Directions program, but with clients in general. What is this and what does it do?
Yeah, so this machine is called the Review Metabolic Machine. So what it is, it tests your resting energy expenditure. So from doing this test, we can help pinpoint essentially what your resting energy expenditure is, or how many calories you burn at rest. So from that information, we can tell how many calories you would need to eat to, say, maintain weight, gain weight, or in this case to lose weight. So what it does, so this machine, the Review Metabolic Machine, takes about 10 minutes to complete. So we actually plug your nose and then you create a tight seal around the tubing. So as you breathe in and breathe out, it's testing the amount of oxygen that you consumed. So from that information, there's a direct correlation between oxygen consumed and calories burned. So we can utilize that information as part of your individualized plan for weight loss to help us determine how many calories would be appropriate for you to be able to lose weight.
So in general, there's guidelines out there. I think people know that based on your weight and your height and whatever else, you might have an idea. But being able to pinpoint it like this, how much of a difference does that make?
Yeah, so you're absolutely right. There's general guidelines out there, but it's hard to know. Every person is different. So multiple things impact, say, the results on this machine, such as, eating habits, what your body habitus is, and different things like that. So utilizing this machine can help us make more of an accurate assessment on what you would need, especially if you're in maybe a little bit of a weight loss plateau and need kind of more direct information on what's really going on. This machine can help us see, okay, is there a missing puzzle piece that we might not be aware of how your metabolism looks too.
And that's something you just can't figure out on your own or through a program where you don't have this kind of expert advice.
Exactly.
People might have noticed I have my laptop sitting in my lap. I'm kind of keeping an eye on what's happening live, so if you have any questions that you would like to put in, you can go ahead and post those in the comments, and I'll do my best to pay attention to them. However, if I don't see them, or if we wrap up this broadcast first, you can go ahead and keep posting those questions even if you're watching the replay later, and we'll go ahead and circle back and get those questions answered to you. We have one more machine that we want to talk about, but since I mentioned the questions, I know that there's probably one on a lot of people's mind, and that has to do with things like cost and insurance. So where can they get started about trying to figure out if financially this is something that makes sense for them?
Yeah, great question. So for the machines, generally they're not covered by insurance, but if you know you have insurance coverage for them, we can submit to your insurance company. There is a 30% discount for paying upfront for the machines, but for more information on any of the cost, whether it's for the machine or the New Direction program, we'd encourage you to call the Bariatrics Center for more information.
Jackie, I've got to ask, when it comes to New Directions, I've seen, just having heard working here at Nebraska Medicine, some of the success stories. What's that part of your job like, and what do people find besides just the number on the scale dropping, as far as how does it change their life?
Yeah, that's a great question, and that's my favorite part of the job. That's why I love what I do, is you really just can see how people's lives change when they lose the weight. I love it. It's an area where I can focus on helping make people healthy with food instead of adding more medications, which they still have a very important role, but just allowing us to take more control of our health through knowledge and knowing what you're putting in your body. People's energy levels improve, their confidence, their mental state can improve just when you're feeling better in your own body. Things that we take for granted, like going up and down stairs, getting in and out of your car, playing with kids or grandkids, are some of the biggest things that people say have really changed in their life.
And it makes a huge difference. We have one question that came in. Diane, thank you for watching. Wants to know if there's lactose-free options in New Directions.
So we do have people who have a lactose intolerance that have done well on the program. I think it depends on each person. If you have a milk protein allergy, that's a little bit different because they are dairy-based products. So it would be something I'd encourage you to come in. We can talk about it, try some of the products, and see how you tolerate them.
We talked about the review here. There is another machine that you guys have that is a scale, the Embody. What does that do?
So the other machine we have in our center is called the Embody Scale. So what it does, it tests what your body composition is. So it tells us what your weight truly represents. So it's going to tell us, say, muscle mass versus fat mass versus what is body water. So this can be a great tool, especially it's very neat. You can trend the information on it. So as you lose weight over time, we can do this scale again to hopefully see that fat mass decrease or your body fat percentage decrease while muscle mass maintaining as much as possible. So it's very neat that we're able to trend that information. I also think it's interesting as well too to utilize that machine. Say someone has change their exercise routines and habits and they're maybe not seeing that number on the scale budge like they want it to. This machine can help us assess, okay, well maybe there's changes in your body composition, changes in say muscle mass versus fat mass, and you are seeing successes. It's just from your body composition and maybe not the number on the scale, but overall still moving in the right direction.
I think as women, it's easy to get caught up in the number on the scale. And sometimes hormonally things are, so it's good to have an explanation for what's going on. If you're doing the work, you deserve to see the results. Also with the Embody, I would imagine it helps for people that have a higher muscle mass, people that are more athletic, because their BMIs might show up as being overweight when they're not in that.
Yes.
So it's a more fair assessment than just that number on the scale. And if somebody's not maybe necessarily at the level of wanting to enter New Directions, but they would just like to come in and get on the scale and meet, is that something that's an option too?
Yeah, great question. So anyone can utilize either of these machines. You don't have to be a patient in our clinic. That being said though, if the New Direction route isn't what you want to go, we do offer individual nutrition counseling sessions. So you can meet individually with one of the dietitians in our center to really come up with an individualized weight loss plan, talk about some lifestyle changes, some behavior changes to most set up each individual person for weight loss success.
It's a tough journey, and when you have people there that are there to support you, the science behind it with these machines and the experience, it can make a huge difference. So if anybody out there is interested, starting with one of the informational sections on New Directions might be another way. What else would you advise? Maybe just checking out the website online?
Yeah, the website has some great information on it. We actually just recently put a whole recipe book for new directions if you want to check out some things you can do with the shakes. But like Rebecca said, we can start you off with that video where you can watch in the comfort of your own home when it works best for you before you actually invest the time and come in. If you have any questions or concerns, I think it makes a difference to talk to someone about your specific individual situation, and we'd love to talk to you more about that.
You guys would like to see some more of those success stories and see those people really
absolutely.
making those life changes.
Absolutely.
Well, thank you so much for your time today, and thank you for the work you do. And if you are watching, don't forget, go ahead and continue to post more questions, and we will keep following up on those. And if you know someone who might be interested in the program, go ahead and share the video with them, and we'll keep up with the questions or any more information as fast and as rapidly as we can to get your response. So don't worry if the live broadcast has already ended. And if you're looking for those resources, you can call here. It's 402 559-9500. Is that right, Lindsay?
Yes.
See, there we go. 559-9500. Or the website is nebraskamed.com/lose, or just go to nebraskamed.com. You can type in bariatrics, weight loss, new directions. Any of those should get you to the proper site. So we appreciate your time today.
You're welcome.
Thanks to all of you for watching, and go ahead and keep up with the questions, and we will see you next Wednesday for our next Moments in Medicine.